Welcome back to MDTV Medical News Now. We all have something that we would like to change about our facial appearance. Perhaps you have crow's feet, the wrinkles around your eyes, or sagging cheeks and neck. Well, there are a number of different approaches to treating these problems. In addition to the aging process, external factors such as exposure to the sun, smoking, and pollutants cause the skin to lose its vigor and elasticity. Degradation of the skin's collagen and elastin fibers leads to the wrinkles and fine lines that give away our age, or even worse, make us appear older than we really are. To reverse the effects of aging, the board-certified plastic surgeon may turn to chemical peels or laser resurfacing. These procedures seek to stimulate the architecture of the collagen and elastin so that the healed skin has a more vibrant and youthful appearance. Now, when the ravages of age have left you with more than just small wrinkles and fine lines, a rhytidectomy, more commonly known as the facelift, may be for you. The facelift is a repositioning of the skin and deeper tissue of the face and neck. About 90% of facelifts performed in this country are done on patients over the age of 40. Oftentimes, a facelift is combined with other procedures, such as a forehead lift, an eyelid lift, and laser resurfacing in order to give the patient the most youthful, rejuvenated appearance possible. We're speaking with Dr. Zachary Gerut, a member of the prestigious American Society of Aesthetic Plastic Surgeons, whose practice is dedicated totally to cosmetic surgery and is certainly an expert on the topics of facelifts. Dr. Gerut, what can really be achieved during a facelift?
Well, the better answer to your question would be what can't be achieved with a facelift. With all modern technology that we have today, laser resurfacing, chemical peels, collagen injections, there are so many things that can be used for so many of the problems that make us appear older that we generally can take care of most of the things that bother a patient.
How has this procedure evolved over the years? How far has it come, and where is it really at right now?
Well, about 50 years ago, interestingly enough, there was a woman named Madame Noel who was doing facelift procedures in their infancy in the basement of a Paris apartment building.
Oh my goodness.
The French bun was the predecessor of her facelift, pulling the sides of the face back as tightly as possible. Since that time, we've come a bit of a way. The initial facelifts done in the 50s were pretty much skin operations, pulling the skin a bit tighter. In the 60s and 70s, doctors began to concentrate on the structures below the skin, tightening up the what we call fascial layers, which control the muscles and to some extent the fat of the face and the neck muscles. And recently, borrowing techniques from craniofacial reconstructive procedures where the bones of the face are rearranged, doctors can remove, literally, the entire soft tissues of the face from the bone and lift the face with a procedure called the subperiosteal facelift. All of these techniques put together and used judiciously on the proper patients for the proper reasons can yield fabulous results for the right kind of patient.
Does a patient need to take extra care after this procedure is done?
Well, there are many things that patients should and shouldn't do before and after a facelift. One of the things that immediately comes to the plastic surgeon's mind as far as the do's and don'ts is smoking. Smoking can ruin a good operation for sure. Most doctors will have a very, very important and very tight regimen of things of what should and shouldn't be done by the patient, both before and after the operation, and my best advice would be for the patients to follow their doctor's orders.
Now, I'm sure that immediately after surgery, a patient has got to be puffy. You've got to see that something was done. How long really does it take for a patient to look in the mirror and say, wow, I'm seeing some results here?
That's a good question. My patients are always asking me, doctor, when will I look good? I have to ask them a question back, to whom do you wish to look good to? I tell my patients between a week and 2 weeks after surgery, they'll be able to go places where no one knows them, and their faces will be puffy, but no one met them before this time, so they don't know their face is larger. Okay. As time goes on, the patients look better and better to different people, but generally they look good to themselves last. It takes quite a long time before a patient will look in the mirror, as you say, and say, wow, I'm really happy with this.
Okay. We're joined now by Barbara Gellerman, a patient of Dr. Gerut's, who's had facial rejuvenation performed at the doctor's Long Island, New York practice. Barbara, welcome to the show.
Thank you.
What exactly did you have done?
I had a lot of face work from Dr. Gerut, starting from either, let's see, I had a full brow lift, which also corrected my bridge of my nose. I had facial surgery, I don't know what you call it, here, my full neck, I had my lips made a little fuller, but not enormous.
How were the treatments? Was there a lot of pain involved?
Absolutely not. Absolutely not.
None?
I had one painkiller the first evening that I took only because I was afraid what might happen.
Well, now, what made you choose Dr. Gerut? That's what I would like to know.
When I might have been searching for someone, it started off very casually. I asked around. I'm an electrologist, and I asked one of my patients. She had other surgery, other body surgery from Dr. Gerut, but her mother had a facelift from him. And I spoke with the mother, and she got Dr. Gerut's name from her friend, who is a surgical nurse at a hospital. And that's always your best recommendation.
Sure. Doctor, what was Barbara's case, and exactly how did your treatments help, do you feel?
Barbara wanted to have a more youthful appearance to her forehead, and she wanted to have a more youthful appearance to her neck, and to remove all of the little, well, as little as it was, bit of sagging skin around the corners of her mouth and her cheeks. Oftentimes when I analyze a patient's face for rejuvenation, I find minor, very minor items that would benefit the patient, such as enlarging the lips, because lips very often do get smaller as we get older.
Right. What other less invasive procedures are available besides a facelift?
There are many people who, either because of their age or because of their fears, are not ready for a facelift. And for these people, there's a whole host of items they can make use of to get the little bit of touch-up, or however small procedure you want to call it, to look better and feel better. People who aren't ready for surgery can undergo collagen treatments, alloderm treatments, Botox injections, which selectively remove wrinkles from areas by paralyzing the muscles selectively. It isn't dangerous because you cannot overdose on these injections. There are various chemical peels and laser peels available of different depths to the skin. Therefore, the healing times vary tremendously, and patients should choose judiciously.
Well, Barbara, we appreciate you coming by to share your experiences with us today.
Thank you.
If you would like more information about facelifts and facial rejuvenation, you can call the American Society of Aesthetic Plastic Surgeons at 1-888-272-7711. Or you can reach Dr. Zachary Gerut and his staff at 1-516-295-2100.